I'm so happy to be here and to have this opportunity to talk with all of you a bit about equity. Equity is what Even the Odds is all about. It's the focus of my life and my work. It's an idea that I know has really inspired David and the leadership team at Staples, and I hope that it's something that you can get excited about too. So, what is equity? I'm going to walk you through what equity means to me and to the scientists at MAP. What you see right now in this picture is inequity. It's easy to see that the odds are stacked against the person on the right. No matter how hard they work, it's unlikely that they'll be able to get enough to eat. Programs and solutions geared towards equality rather than equity sometimes miss the mark. In this picture, everyone gets the same amount of support, which feels like it should be a fair solution. But the odds are still stacked against the person on the right. Even though they have the same tools as the person on the left, they don't have the same odds of being successful. This is the beginning of equity. In this slide, you can see that equity is about making sure that people who need the most support get the most support. This is part of what we do at MAP. We develop solutions to address urgent problems and make sure that people get the support they need. The solution could be an outreach program to bring health care to people who are experiencing homelessness, or a program that helps women and children escape violence at home. So this is true equity. Everyone can now have a fair shot at success. The system was unfair, so we've changed it. This is the other side of the work we do at MAP. We work to address problems at their source, to prevent inequities from existing in the first place. We do this work through partnerships with governments and policymakers to fix unfair systems and policies. I really like these illustrations because they make one thing totally clear. There's nothing wrong with the people in this picture. They're doing the best with what they have, but there was something wrong with the tree. MAP is a world-leading research center based at St. Michael's Hospital and affiliated with the University of Toronto. We're a team of 27 scientists and 120 research staff and students. These are Canada's leading experts in equity and health, each with their own areas of expertise. So what does equity have to do with health? In Canada, our household income, education, and experiences of discrimination strongly affect our odds of staying healthy. Our social and economic status determine how easy or hard it is for us to access the resources that are essential for good health, such as affordable housing, nutritious food, and healthcare. Our scientists work with communities and research partners across Canada to understand equity problems from the inside out and from the ground up. Based on what we learn, we develop programs and solutions to address inequities and make sure everyone has the opportunity to thrive. We work with government leaders to help improve policies and bring our programs to more people across Canada. Many of our scientists are physicians who were inspired to study health equity issues because of the challenges we see facing our patients every day. These are problems that can't be fixed with a prescription. They're system problems. In Canada, 1 in 5 kids live in poverty. Children in low-income households are at very high risk of poor nutrition and childhood obesity. And kids who start life with these issues are much more likely to face serious chronic health conditions in adulthood, including heart disease and diabetes. So here's one of the ways that MAP is responding. Dr. Katerina Maximova is a MAP scientist. She leads Apple Schools, a program designed to set kids up for a lifetime of healthy eating, physical activity, and mental health. The program currently reaches more than 21,000 students every year in schools across Western Canada. We plan to increase that number to 62,000 students nationwide by 2025. Kids who participate in the Apple Schools program are 40% less likely to be obese. They're also better learners and they score higher on academic tests. In addition to improving outcomes for these kids, it helps prevent future healthcare costs. For every $1 spent on Apple's schools, $5 in future healthcare costs are avoided. Let me tell you about another equity issue that MAP is working on. More than 1 million people in Canada go without basic needs like food or heat, so that they can afford to fill their prescriptions. In fact, Canada is the only high-income country where healthcare services are publicly insured, but prescription medications are not. So even if a person can get the right diagnosis from the best doctors, if they can't afford the medication they need, they won't get well. My colleagues and I have seen firsthand the impossible choices our patients are sometimes forced to make, just to be able to buy the prescription that they've been prescribed. So this is how MAP is responding. Dr. Nav Persaud is a family doctor and a MAP scientist. He's leading the first trial in Canada to provide people with free access to essential medications and to measure the effects of this on people's lives and on the healthcare system. The results have been truly remarkable. It's common sense that giving people the medication they need will improve their health, and he's proven that it does with this study. But the study has also shown that when the cost of people's medications are covered, it saves the healthcare system money in the long run. Participants in the study visited the emergency department less often, and they were hospitalized less often, and this resulted in cost savings that outweighed the cost of providing them with medications. His research findings have helped advance the movement towards universal pharmacare in Canada. He's at the table with decision makers as part of the Canadian Drug Agency and a federal government advisory council. And he's written the roadmap that I believe is going to make universal pharmacare happen in Canada. Now, I'd like to tell you a little bit about my own work on homelessness and health. 235,000 people are homeless in Canada every year, and 20% of these individuals are youth between the ages of 16 and 24. Homelessness takes a profound toll on people's health. I work as a physician at one of Canada's largest homeless shelters. Sometimes I feel like I'm applying Band-Aids without getting to the root of my patients' enormous health challenges. People experiencing homelessness in Canada live with almost constant risk of assault, infections like COVID-19, and risk of injury and death from exposure to the cold in the winter and to heat in the summer. Mental health problems are very common and extremely difficult for people to manage and overcome when they have to focus all their energy on basic survival needs. As a research scientist, I'm developing new approaches to housing and supports that could end chronic homelessness for good. I co-led the largest research study in history to evaluate solutions to end chronic homelessness. This study tested the Housing First approach, which offers rent supplements and case management to people living with homelessness and serious mental health issues. The project helped more than 1,000 people in provinces across Canada. Dawn, the woman in this picture, is one of them. She spent her early teenage years in group homes, and by age 16, she was on her own. When we met her, she was staying in a shelter and struggling with her mental health. Through the at-home study, she moved into an apartment, and our case managers helped her get the mental health support that she needed. With a secure place to live and her health problems addressed, she could focus on changing other aspects of her life. She's reunited with her kids and even published a book of short fiction. For hundreds of people like Dawn, the program has been life-changing, an opportunity to get the support they needed to address their health issues and to achieve permanent, stable housing. As a result of this project's success, the federal government adopted the Housing First model in communities across Canada. We're now expanding and improving the Housing First model to bring it to more people. Housing First programs are becoming more and more common in Canada, and my MAP colleagues and I are working to build it into our national housing and health policies. These projects I've described, Katarina's, Nav's, and mine, are just a fraction of the work we do at MAP. Our scientists, staff, students, and community partners have come together to work for equity because we believe it's the right thing to do. We also know that equitable communities work better for everyone. Studies around the world have shown that when people who are the most marginalized in a community do better, everyone does better. People in more equitable societies live longer, have better mental health, and are more socially mobile. Everyone benefits. So that's how MAP is working for equity. I'm hoping you'll join us to help even the odds in Canada. It's about fairness, fair systems, and fair outcomes. It's about a commitment to take care of one another. And it's about the idea that equitable communities work better for everyone.